So we're going to begin with Dana Rose Garfin, an assistant professor in the Department of Community Health Sciences. And please join me in welcoming Professor Rose Garfin. Thank you so much.
All right. Good morning, everyone. All right. So I'm very happy to be with you today. I was trained as a psychologist, and my expertise is in how people respond to adversity, both at the individual level and the community level. And over time, my work has evolved to incorporate media exposure because it's just evolved to be such a big part of how we experience large-scale events. So collective trauma are large-scale events that impact the populace broadly through direct and media-based exposure, and they are an increasing threat to public health. These threats include natural disasters, which are increasingly exacerbated by the escalating climate crisis, conflicts such as the ongoing war in Ukraine, and the explosions of mass shootings across the United States. These collective trauma occur often and have cascading and compounding effects on the populace. And importantly, we rely on the media for information and direction during times of crisis. So when Dr. Dorian was speaking earlier today, she asked, "Where were you in March 2020? I was glued to the news, just like everybody else, wondering what was going on and what I should do about it." However, despite the importance of media exposure for conveying information during crises, it can also elicit distress responses. So this is data from a nationally representative, probability-based sample of US residents with oversamples from Boston and New York. And in this study, my colleagues and I found that as media exposure to the Boston Marathon bombing increased, so did acute stress, which can be thought of as early post-traumatic stress disorder, or PTSD. In fact, as this graph shows, at the highest levels of media exposure, which are indicated in yellow, media exposure was more distressing than even direct exposure to the bombing, which is indicated in the left side of the slide in orange. And in fact, longitudinal findings from this data set found that in addition to the amount of media exposure that people watched, what they were exposed to also mattered. So in this slide, we see that exposure to graphic and bloody images from the bombing were associated with independent effects on acute stress in the early aftermath of the bombing, as well as post-traumatic stress 6 months later. And importantly, this elevated distress had measurable impacts on functional impairment, which is impairment in social and occupational capabilities. My colleagues and I replicated these findings during the recent COVID-19 pandemic. So this is data from a distinct nationally representative sample of US adults, and we evaluated them starting in early March of 2020, during the very early phases of the COVID-19 outbreak. And what we found that was while direct exposure, so here in the orange square, secondary stressors and personal exposures, so that was like, did you lose your job? Did you know someone that was sick? So whether it directly impacted you. That was associated with increased distress, both acute distress, which is in the light gray, and depressive symptoms in the dark gray. And while this was associated with distress, so too was media-based exposure. And moreover, what we found was one of the strongest predictors of distress was exposure to greater amounts of conflicting information about the pandemic. And these findings persisted as the pandemic continued. So these are longitudinal data over the course of the first year of the pandemic. And what we found was that state-level indicators, so deaths, knowing someone who died, cases in the state, as well as statewide mitigation strategies, so lockdowns and mask mandates, those were not associated with psychological problems. However, direct exposure to the virus, so whether you were sick, you knew someone that was sick, or you knew someone that died, that was associated with both traumatic stress responses and global distress over time, as was media-based exposure. And so these are effect sizes. So the higher the bar, the stronger the effect. My colleagues and I also found that these responses accumulate over time as we are exposed to multiple disasters. So we assessed a probability-based representative sample of Floridians who were exposed to multiple catastrophic hurricanes. So here we see Hurricane Irma, which occurred in 2017 on the top, and Hurricane Michael, which occurred in 2018. We found that direct, so actually being there, knowing someone who was harmed, losing property, as well as media-based exposure to Irma was associated with negative Irma-related psychological outcomes. And importantly, these exposures to Irma and these responses to Irma, as well as direct and media-based exposures to a subsequent hurricane, Hurricane Michael, had persistent effects over time, and they were associated with increased distress following Hurricane Michael. And again, these outcomes were associated with measurable impacts on functional impairment. So it's not just that you were feeling more distressed, you were actually functioning worse. However, the media is how we receive critical information about how to protect ourselves from public health threats like viral outbreaks and other disasters. So given that our prior research demonstrated that type of media differentially predicted outcomes, and social media in particular has been implicated as a common source of conflicting and misinformation, which is associated with distress, we sought to explore whether type of media sources may differentially predict protective behaviors to pressing public health threats, as well as factors that might mediate these differences. So we're asking the question, media is distressing, but we need it. So how can we use it more effectively? So using a representative sample of residents from Florida and Texas, we contrasted the impact of traditional media, so television and online news from sources like CNN, and social media, so TikTok, Facebook, and so forth, on hurricane preparation behaviors, as well as COVID-19 protective behaviors on the right. And for both public health threats, we examined efficacy and threat perceptions as mediators of these potential relationships. We found that traditional media had a positive association with protective behaviors, hurricanes and COVID-19, through efficacy and threat perception. We found that social media had no association with protective behaviors, and that social media had a negative association with efficacy for COVID-19 protective behaviors. So you felt that they wouldn't work and you couldn't do them as well. So in conclusion, these set of findings illustrate that high amounts of graphic and or conflicting news information during collective trauma is associated with psychological distress and functional impairment. Yet traditional media exposure is an effective conduit to inspire protective behavior. Social media, which we're going to hear about next, is currently underutilized for conveying accurate information and inspiring action. And so a challenge for us as public health professionals is how to encourage people to limit exposure to distressing information and maximize the potential benefits of the media to improve public health while concurrently minimizing that distress. So thank you to my collaborators, and this set of studies was all funded by National Science Foundation.